Macarthur has been identified as a must-win seat this federal election. It's on a knife-edge margin, quoted as 0.1%. Nick Bleasdale over here, all credit to him, achieved a massive swing against Pat Farmer last election, but not quite enough after last year's redistribution. He's a bit, closer there again. What is Nick and what is the ALP going to have to do to win Macarthur, apart from health?
Yeah, but the people of this region understand the importance of basic local services, and there are three big messages we have for the local people and with Nick Bleasdale as our candidate. One is this: what we did in response to the global financial crisis in the last 12 months was invest economic stimulus in this local economy to the tune of $340 million to protect local jobs, to protect local apprenticeships, and to support local small businesses. Part of that is our investing, of course, in the local school modernisation program as well. So if you ask local people, ask local tradies, local subbies and the rest where they've been getting work from in recent times, a large number of them will say it comes off the back of the investment in the school stimulus strategy. Second thing is this: in this area we've got something like 59 schools, 141 projects being benefited by a $114 million investment while I said this. And if I go to those local schools, and for example I went to one at Minto, I think when I was last in this wider region. There at Minto, I was there with, I think, the bulldozer as we turned the first sod for what will be their first, I think, from memory, multi-purpose hall. But schools in the area getting new libraries, new resource centres, new language centres, new science centres, new multi-purpose halls. None of those investments would have happened were it not for our decision to invest in this community. Ask the mums and dads, the PNCs and the PNFs, whether they support these investments, and you get a pretty solid answer. But ask them this question as well: who voted against all of these investments? Answer: Mr. Abbott. Mr. Abbott has further said that if he becomes Prime Minister, that he would bring a stop to the investment in these schools on the ground. So for the Liberal candidate out here, name the schools, name which building, name which individual project would stop. The third thing is this: health and hospitals. We've already made some investments out here as well. And of course the investment we've made in Campbelltown Hospital, the additional purchase of surgical equipment, as well as investments in the local divisions of general practice and additional University of Western Sydney training programs for medical nursing, midwifery, physiotherapy, psychology students. So what do I say all that? That's additional medical services here on the ground in this local community. The sports nuts are also investing in the Campbelltown Stadium. And that's a significant one. I think it's about an $8 million investment. $8 million? I think I'm opening it in May. A couple of weeks. There you go. There you go. Jobs,
yep.
Schools, this hospital, local stadium.
Well, just on jobs.
In terms of delivering locally in a very practical way, that's what we've done in an area where we haven't had, frankly, the local federal member on our team. And the local Liberal candidate needs to answer the question: what school projects will he shut down?
On jobs, it's hard to dispute that at a national level, unemployment has been handled quite well through the GFC. But locally,
in fact, it's the second lowest rate in the major advanced economies of the world.
But locally here, this is one of the few areas of Australia where unemployment actually rose through the GFC. What do you think needs to be done here? What special treatment do you need to deliver to the
one of the
Macarthur
things
area
we've done in this area,
situation?
you talk about high unemployment in other parts of Australia. I've just come from far north Queensland. The unemployment rate in and around Cairns at the moment is 12.3. So you have a number of regions where unemployment has actually gone up significantly. So what have we done practically on the ground? In areas such as this, we've appointed local employment coordinators, and local employment coordinators have been working very much with the local jobs providers and the various economic stimulus projects that are underway to generate more jobs on the ground and to link people who are looking for a job with project opportunities which exist. We've done that in 20 locations around the country. We have a local employment coordinator in this part of the world as well. From memory, one of my earlier visits out here was in fact to a forum which involved all the local chambers of commerce in this area. And when I visited May last year, Community Jobs Forum, Campbelltown City Council. That's when we announced the appointment of a local employment coordinator specifically to help bring down the local rate, given we expected here that there would be a particular impact on the jobless numbers.
Nick Bleasdale over here has challenged his Liberal counterpart Russell Matheson to a debate on health reform.
Sounds like a plan.
Our newspaper, the Macarthur Chronicle, has offered to host that debate, but on one condition, that it's not just limited to health, that it's an open debate. And we would moderate the debate so that it's independent.
These guys are fair and independent paper, mate.
They are, but as I've said, Prime Minister, I've said.
Well, I'm asking Kevin here. Sorry, Nick.
No, I'll ask
Kevin. Do you give Nick your blessing?
I won't debate him on all issues closer to the election, but at the moment, what I'm hearing is Hilton Hospital.
Would you give Nick your blessing here and now to take part in an open debate, not just limited to health, hosted by the Macarthur Chronicle?
I back my local candidate. He can make his own call locally about what debates he's in and how they're organised and what topics they're on. And guess what? This is happening right across the country. Different formats, different debates, different topics. The key thing is actually the policy differences are actually put on the table.
But he doesn't need to ask anyone's permission. If he wants to do it, he can.
Can I just say, I fully trust my local candidates to make their decisions locally about who they debate and where and about what. That's a matter for them, as it is in 150 other seats around the country. The other thing I'd say about, you just mentioned the local Liberal candidate. I saw a great quote here just a little while ago, which strikes me as a bit odd, where apparently it said, quote, Abbott's health policy is going to be very similar to Rudd's anyway. Well, that's somewhat of a turn up for the books for me. I think that is in, would you believe it, the Macarthur Chronicle. I think Mr. Abbott would be very interested to hear that because every day Mr. Abbott attacks comprehensively.
I think he was very interested to hear it.
Attacks comprehensively every element of the health policy and hospitals policy I put forward. So it's very easy to try and get away with saying something like that locally when your federal leader is comprehensively opposed to the National Health and Hospitals Network that we put forward. The other thing is this, maybe they're a bit embarrassed about Mr. Abbott's record as health minister because when he was for nearly 5 years, ripped $1 billion out of the public hospital system of Australia, that includes public hospitals like this, and also froze training places for medicos. You want to see the flow-through effect of that. It means you've lost, frankly, a generation of young doctors who would otherwise have been trained to be out there in the workforce.